Hi there, my name is June. I'm going to show you how to change an occupied bed and how to change an unoccupied bed. So for starters, I'm going to just roll right into this. I've gathered my supplies. I'm going to enter my patient's room, close the door, close the curtain, provide privacy, perform some hand hygiene in front of my patient. I'm going to identify myself and say, "Hi Jessie, my name is June. I'm going to be your nurse today. Can you please tell me your full name and your date of birth?" I'm going to compare that to the name band on Jessie's wrist. So important to make sure that I've identified my patient with at least 2 identifiers. When that's all good, I'm going to explain what I'd like to do, or maybe Jessie has asked me to change the bed, or maybe he's just had a bath and it's time to change the bed, or maybe he's soiled or wet and it needs to be changed, but he's unable to get out of the bed. He can assist me a little bit. I've determined in my assessment, so I don't need a second nurse to come and help me. I can do this on my own. I'm going to show you a few techniques so that you maintain your safety and patient safety and move as efficiently as possible through this and get our patient comfortable and warm and dry again. So, a few things to start off. I've made sure I've gone around and checked to make sure all the locks are on the bed, bottoms and tops. You can see that I have the railings up on both sides because Jessie, we're up high and we want Jessie to be safe from accidentally rolling out of the bed. I raised the bed up to good height for me because I'm always observing good body mechanics. I should never be bending over or reaching too far. It's so important that we begin with good habits when we're doing tasks like this, that we don't overstrain or lift too much or pull too hard. So good body mechanics are really important. So I have all my supplies, and so what I'm going to do is I'm going to just clean my hands again because we always perform hand hygiene before we put on gloves and after we remove them. So I'm going to go ahead and put on my gloves because I have determined that I will be coming in contact with wet and soiled linens that potentially have bodily fluids on. So I've got my gloves on. I brought a bath blanket in with my supplies just to kind of expedite this and maintain Jessie's dignity and comfort. I don't want her to be cold or embarrassed. So I'm going to quickly take off the top spread and the top sheet. And we never put our linens on the floor. I'm going to drop those into a hamper right away that is specific for Jessie. It's his. And so then I'm going to cover Jessie with a bath blanket that's nice and dry so that he will stay nice and comfortable. And as I said in the beginning, Jessie has determined, and that he's able to help me a little bit by turning. So I'm just covering him up like this. And so the first thing that I'm going to do is put my railing down. And I have all my supplies really close and handy to me. I don't have to leave this side of the bed right now. So I'm going to help Jessie bend his knees. And he's going to turn on his side, and he's going to grab that railing right there. He's strong enough to do that, and I'm just going to help him get his legs bent so that he's in a good side lying position and comfortable. Make sure the pillow is comfortable for him. You can see what I'm doing there. I'm making lots of space for myself to set up and change the bed quickly and efficiently. So I'm going to remove this section or this side of the linens first. So I'm going to take that sheet off, I'm going to push it under. And I'm pushing this under all the way across, loosening it from the bottom edge, and pushing that all the way under Jessie. And Jessie's hanging on to the railing there. Then I'm going to grab my clean bottom sheet. We try not to shake our linens around very much at all because it stirs up anything that's in the bed or in these soiled linens. So I'm going to just attach the corner to the top with the new bottom sheet. Follow through and come down to the bottom. Attach that bottom fitted sheet right there. Just tidy it up a little bit. And I'm going to push that under my patient. And I'm going to further push it even more under those soiled, under but it's in the clean area, and I'm going to push it way in under the pillow as much as I can, and I'm going to tell Jesse what I'm doing all along so that he's not frightened or feels like he's going to fall. Then I'm going to take my new soaker pad. I'm going to line up the first edge at about Jesse's shoulder blades and down below the knee at the edge of the mattress. Then I'm just going to make some rolls. I'm going to push on Jesse just a little bit, and I'm going to make sure I can see the old or the old set of linens, the soaker pad, and I'm pushing that under. So I'm telling Jesse you're going to feel a little bump there. It's okay. And I'm ready. So I'm going to put that railing up so that Jesse's safe. And I'm going to come over here to the other side of the bed. Back over here with Jesse. Hi, Jesse. Put my railing down. And now I'm going to tell Jesse I'm going to lay you back now. So I'm going to very carefully help him. Jesse's okay to come back. I'm going to tell him there's a little bump and it's just going to roll over that way. And then Jesse's going to reach for the other side. So we're going to gently turn him to his opposite side. And help him with the pillow. He can hold on to the railing there. As you can see, we've successfully pulled out all of the soiled laundry. Pull that right out. Bunch it all up. Try not to shake it around. Drop it in the hamper. And then we can grab our clean edge, pull that on. Roll out our soaker pad. That's under Jesse. And we can return Jesse to his back. And I'm just going to straighten everything out. Make sure the bed is nice and straight and that the linens are tidy. And I'm going to remove those gloves now because that's all clean. And I'm going to perform some hand hygiene. Now I'm ready to just finish up covering Jesse with a new top sheet. And as I come up with the top sheet, I'm going to remove that back blanket. Put that railing back up right away. And bring that sheet right about to just under their chin. Spread on. And I've got both railings up so I know Jesse's safe on both sides. Try to make sure that your top sheet is lined up equally on both sides so that when you do your hospital corners you don't have anything hanging out. And then line up your spread on top of that. And again, just about under the chin. Pull the excess down. Check both sides to make sure. Good. Then you're ready to tuck in. So come to the bottom of the bed. You're going to make a nice tuck under the bed. And then your hospital corner is simply coming down about 2 feet or 1.5 feet. You reach down and you grab both the spread and the sheet that's just under it and come up at a point. And let that point be right there. And then this that's hanging down, you're going to tuck very neatly. Don't let it bunch. Tuck it neatly. And when you let that go, you have your hospital corner. Over here, we'll do the same thing on this side. Tuck that in neatly. And turn. Nice cuff. And for your patient. I already changed the pillowcase before we started just to, but of course you change your pillowcase. And then return your patient to a nice setting of hours if that's what they want. Like to read or watch TV. Maybe they're going to have breakfast or lunch now. And if they don't want to, then of course they can lay down. Whatever their comfortable position is, return them to that. Lower your bed to the lowest position. Make sure your patient has the call bell handy so that they can call you if they need to. Clean up everything that is part of your bed changing task. Go. And then make sure that you return your patient their bedside table over their bed so that they can reach it with any of the items that they might need. And that concludes our occupied bed. Now I'm going to move on and show you pretty much the same procedure, only now we're going to make a bed that is unoccupied. Okay? Just going to move over here. The bed is clean, so I don't need to put on gloves. I'm just changing a clean bed. I'm just going to move this out of the way. I've already raised the bed up to a comfortable working height using good body mechanics, and I've already changed the pillowcase on the pillow just to save us a little bit of time doing this. So I'm going to come over here. Again, we try not to shake things out any more than we have to. It's just good practice. Go ahead and attach the bottom sheet first. Soaker pad you line up with each side of your spread. I'll fix that a little bit on the other side. And it's about down where you would guesstimate your patient's shoulders would be. Top sheet. Line that up near the top of the bed. And And then I'm just going to make sure before I put my spread on that my top sheet is equal on both sides and not hanging down too much on either side. We never allow our linens to drag on the floor. We never allow the white part of the sheet to hang down below the spread. It's just not what we do in our profession. So now I'm going to put my spread on top. Line that side up so that it covers the sheet on this side. And I'm just coming up to the level of the sheet, the top sheet that I just placed at the head of the bed. Checking again to make sure that that's all nice and tidy, good quality, tidy bed. I'm going to tuck that in nice and neat and snugly underneath. And then I'm going to just come this way so you can see. So you can see I'm coming up about a foot or 2 feet up from the bottom of the bed, reach down at that area, grab both the spread and the sheet and come up, make that angle. Okay? Tuck all of this under, nice and neat. And when you let that fall, you have that hospital corner. Okay? And do the same thing on the other side. And you fold down in an unoccupied bed several inches. And I did put a clean pillowcase on already. Depending on your institution's policy, sometimes an unoccupied bed, if it's open or closed, they'll determine whether or not that bed stays in a raised position or down to the bottom. I'm going to lower it to its lowest possible position, but not let the linens drag on the floor. You don't need to put the railings up on an unoccupied bed. Return the bedside table to its position, either at the foot of the bed or the frame. And that concludes our demonstration of an occupied and an unoccupied bed. Thanks.